We know that you want to provide excellent care to your patient community. Your hospital has chosen to work with Shearwater Health to help you achieve this goal by building strong teams of dedicated, diverse nurses.
We want to help you welcome and engage Shearwater nurses into your hospital community so that they are excited to continue their careers with you for many years to come.
But building a strong, tight-knit community of nurses from different backgrounds and cultures can be difficult and requires intentionality.
So we want to share 3 principles that will impact the long-term retention of Shearwater nurses. These will include tips and guidance on how to build lasting relationships. Your most effective tool is clear communication. It's important to remember that a person's communication style is highly dependent on how, where, and from whom they learn to communicate. Different cultures will have different communication styles. Here are 4 tips to implement in your hospital to effectively communicate with Shearwater nurses. Be as direct as possible. For example, instead of saying, "It'd be nice if somebody could get a blood pressure in room 5, say, "Jane, could you please get a blood pressure on Mr. Smith in room 5? He's been slightly hypotensive and we're trying to keep a close eye on it. I'll be in room 3 if you have any questions." Encourage the repeat back method when communicating with Shearwater nurses. This eliminates the possibility of miscommunication and allows for clarification. Provide real-time feedback. Instead of addressing an issue days or weeks after it occurs, address the issue as soon as possible after it arises. Our nurses are eager to learn and improve their nursing practice. Don't be afraid to ask our nurses to slow down their speech or to repeat themselves if you don't understand them the first time. Encourage them to do the same thing with you and with their patients. All of our nurses speak English, but it won't come as a surprise to you that many of them have an accent and may think you have an accent too. Remember that effective communication is a skill that requires openness and patience from every team member involved.
Treat Shearwater nurses as employees, not temporary or travel nurses. One of our biggest shared goals in bringing international nurses to your hospital is to increase retention. Shearwater nurses sign multi-year contracts and often see this as a permanent move for themselves and their families. Our hope is that they are in your hospital community long after they've completed their contract. Here are 3 ways that you can help Shearwater nurses feel like they're part of the team. Onboard Shearwater nurses the same way you would any permanent nurse employee and include them in your own employee incentives, awards, and retention programs. Introduce nurses to other interdisciplinary members of the team and their role. This will help the nurses to feel integrated into the broader hospital team, and it will equip the nurses to solve problems on their own in the future. And we'll say it again because of its importance, but please do not refer to Shearwater nurses as travel nurses. Both the hospital and the nurse have made a long-term commitment to each other. Treating Shearwater nurses like you would any other employee will make them feel at home and part of the team, which will make them more likely to stay on after their contract is complete.
Practice empathy. A key component of working closely with someone from a different culture is empathy. Seek to understand the nurse's perspective, which will help you understand their thoughts, actions, and worldview, all of which are most likely different than your own. Here are 3 practical tips to practice empathy. Ask questions and be curious. It's easy to assume and avoid talking about cultural differences, but asking someone about their own experiences is an excellent opportunity to learn about one another. Put yourself in the nurse's shoes. They just moved to an entirely new country with new food, people, and cultural norms. They've also transitioned their careers to a new hospital with different processes and procedures. While Shearwater nurses have years of nursing experience, this adjustment can often take some time. Putting yourself in these nurses' shoes helps you display kindness and patience when a nurse feels overwhelmed or has questions. Take the extra step to include them in conversations and lend a helping hand as they build relationships in their new community. Don't underestimate the impact of small acts of kindness and encouragement.
To build strong nursing teams that achieve great patient outcomes, it takes commitment from everyone involved. We hope that these tools help your hospital staff to develop long-lasting relationships with Shearwater nurses and drive retention within your hospital.